Jen, thanks, especially for stretching. You know the saying, nobody's perfect, but that doesn't stop a lot of people from really trying. A personality trait that can lead, though, to multiple health problems. Dr. Stephanie Bean specializes in age management. She's with the Med Club of Tampa. Good to see you. Thanks for being here. I'm fascinated already by our conversation so far. We make light of people trying to be perfectionists, but I mean, in the pursuit of it, you can really mess yourself up, can't you?
Yeah, perfectionism has an upside. People are high achievers, but there's a downside to that. There's studies that show that 51% of this type of personality trait can develop high blood pressure, heart disease, and I think that's just the cortisol and some of those hormonal changes that go about.
So I mean, not just so that you can actually put your finger on medical things going on there that would cause problems.
Oh, absolutely, because you know those high achievers, that perfectionists, hard to delegate. I have to do it my way. This is if I want it done right, do it my way, and that way of seeing things oftentimes puts a lot of pressure on them. That's hard to manage.
May need to make an appointment before before we're done here today. All right, but there's a fine line, I think, between being organized, getting your job done, doing everything right, and being a perfectionist. When do you start looking about the fact you might be in some trouble?
You might be a perfectionist if you're having a hard time falling asleep because you're replaying the events of the day or the week or tomorrow, how it's going to go.
Right.
Might be a perfectionist and have that when, as I mentioned, got to do it my way. If I want anything done right, I have to do it my way. Or you're overachiever. You're obsessed with, I got to outperform everybody in my job. Or like the Thanksgiving holiday, I was great all week, had that one piece of pie, I blew it. Okay, it's not working. Not the right diet for me.
Oh, I see. So even the small little mishaps you might make, you blow it into something way out of proportion. Right. But how do you fix something like this? I mean, once you recognize it, how do you fix it? Because I mean, a lot of people will say, well, I'm a type A personality. It's the way I am. How do you fix it?
It's not like blood pressure where you want to fix that. And it's a detriment to your health. Perfectionism and these character traits actually just get out of hand and get in the way. So first, it's not, don't think about fixing it. Think about is, when does this happen? When might I be a perfectionist? And there's a couple of tips that I do in my practice when we do an evaluation with them. We look at some of the breakdowns that clients are having that are not getting them to their goals. So a couple of coaching tips I give them are set mini goals. Perfectionists tend to create big, lofty goals and dream big. Right. But a lot of times it's unrealistic goals. So do a reality check. What can you achieve? Take small steps, be flexible. And that is also procrastination. Now, it's not stopping procrastination, but it is a way to identify it and say, well, what am I procrastinating? And maybe make that list and just check off and say, I want to do the one that I'm procrastinating the most. Yeah. Check it off your list, have it done.
Hey, we got to go. Will you come back?
I'd love to come back.
Love to have you back sometime, talk more about all this kind of things. It's very interesting.
Thank you.
Dr. Stephanie Bean, thank you. We have more tips and a link to Dr. Bean's contact information at myfoxtampabay.com. Look under the Good Day section. Thanks again.